Hello and welcome to The Print. I am Sumi Sukanya Dutta and you are watching Health and You. The rise of cancer cases in India has emerged as a major public health challenge. A Lancet report that came out just a week has thrown up even more worrying figures. While globally the mortality rates due to cancer is declining, India is an exception. To discuss everything about why the cancer cases in India are rising and why are the reasons not many people are surviving after the diagnosis, we have two very important guests with us, Dr. Ravi Mehrotra and Dr. Sewanti Limaye. Dr. Mehrotra has been the director of the ICMR's National Institute of Cancer Prevention and Research. He's also been associated with the WHO's International Agency for Research in Cancer. Dr. Limaye is a practicing oncologist and she's with Sir H.N. Reliance Hospital in Mumbai. Thank you so much, Dr. Mehrotra and Dr. Limaye, for being with us today.
Thank you for
So,
having us.
yeah,
Thank you for
Dr.
having
Mehrotra, we would want to have opening remarks from you on why do you think, apart from many other diseases that India is capital of, it's now also the capital of cancers.
Well, it's a catchy phrase, being a capital of cancer. But to be very honest, if it we are far behind in terms of the rate of cancer or the incidence of cancer as compared to the West.
Okay.
And the numbers, of course, are staggering, and you're absolutely correct. However, the fact is that we are a young population. More than 60% of India is actually less than 35. And cancer overall is a disease of the aging. But because of our sheer numbers, we are probably number three in the world as far as the numbers are concerned. And that is due to a variety of reasons, which we will discuss later on. So, a few cancers, especially the head and neck cancers, the lung cancers, and of course, the most common one is the breast cancer, unfortunately, are rising rapidly, maybe not in real terms, but in terms of the numbers which are actually diagnosed and treated.
Yeah, thank you so much for those insights. Dr. Limai, you are a practicing oncologist dealing with cancer patients day in and out. So, could you share your perspective on why do you think, despite the rise in incidence, and probably we are catching more cancer patients now than we were doing it earlier, we still see so many patients dying of it despite of all those breakthrough treatments and new therapies and advances in cancer care.
So, first of all, thank you for having me in your podcast. Any opportunity to raise cancer awareness should be welcomed. This is also one of the reasons why we see higher mortality rates in India, because there is significant lack of cancer awareness nationally. Cancer is a disease, cancer is an ailment which I feel is highly discriminated. We feel, the neighbor, the colleague, it will happen only to the other person, other family, and not to us, which is not the truth. We know, as per the Globocan data, 1 in 2 men and 1 in 3 women will be touched by cancer in their lifetime. And that is a recent data as well. So I think if you really look at why we see cancers having poor outcomes in our country, I would say there are two major reasons. One is, of course, lack of cancer awareness leading to late diagnosis. As the stage of presentation gets higher, the chances of cure get lower, chances of complete recovery get lower, outcomes get poorer, survival gets shorter. Second reason is also a lack of access to appropriate therapy, whether it be economic reasons, whether it be adequate availability of drugs, novel therapeutics, clinical trials. All of that can be bunched up together, and it leads to lesser survival in comparison to what we see in the Western countries.
Thank you so much for that. Dr. Mehrotra, you have been working a lot in the space of preventing several types of cancer. And as you earlier point out, many of the cancers that we see, particularly in India, are those which can actually be prevented. So, why do you think, despite probably everybody identifying that these are the reasons, risk factors that are leading to cancers, why we are not really able to sort of address those issues?
Sumi, although I did mention that as per the Globocan, and which Dr. Limaye also referred to, which is the WHO IARC database, the last issue was 2022, just about 3 years ago. We are number three in real numbers as far in the world. I agree that progress as far as awareness and diagnosis is concerned, and that is something that we have been working on, and many colleagues around the country and around the world have been helping us do that. First of all, prevention, or I should say, we used to talk about preventive medicine. Now the term we have tried to change and use the word of proactive medicine, unfortunately, is really not part of our DNA of Indians. I do not want to be negative, but we are still practicing the earlier version of what we call as medicine 2.0, that is a band-aid solution. If you have a headache, you take a pill. If you have typhoid, you take a medicine. And if you have a cancer, you treat it. Unfortunately, doing something, we don't even, and I often take this when I'm talking to my colleagues and the public also, a statement that we don't even go to a dentist until our teeth are practically falling out. You require a root canal treatment or you require a filling. You are in extreme pain. Only then you go to a physician or a dentist. So that same philosophy, unfortunately, we are very good by and large with vaccination of children, for certain infection disease, because it has been going on for a very long time, and the government is also actively supporting it, barring the cancer vaccine, which is still to be started. And even in the private setup, with children, we are very good. Unfortunately for ourselves, and especially, I mean, I hate to say this, but males, if they fall sick, especially the male child, the person will automatically, the girl child, or even and when the same thing goes up as a woman, and we have many good examples here. That is the last health to be given priority to. So when we talk about cancer screening, although I agree the number of centers, tertiary care, or even the diagnostic setups that are there are many now in country, not only in the tier 1, tier 2, and 3 cities, but also in the smaller mufassil towns, where these things are available. In the private setup, definitely. In the government setup, yes, increasingly so. But the concept of going to a doctor or seeing something to prevent a disease just doesn't exist. And you did mention, and I think this was brought out in yesterday's paper from IHME as well, the GBD study, all over the world. They quote, I think, a 42 in 5 numbers, whereas 40% are preventable. In India, actually, it is probably more. Some say it is up to 50 to 60%. And you know very well the cause, which is unfortunately, when you talk about the cancer capital, unfortunately, I will not agree with that adjective, but we definitely are the tobacco capital of the world. We are again number 2 in the world. We take all these number 2s and 3s as if they are a very sign of or a badge of honor. But tobacco is a major issue, and of course, one of the most preventable cause of cancer. And then, of course, you have other issues like alcohol, which is increasingly available and consumed. Lack of exercise causing obesity, which itself is a cause of cancer. And of course, the last one of the many that we have, not the last, but the big four, is also pollution now, which nearly every major Indian city is a problem. I do not feel very happy when I see this list of the 10 most polluted cities in the world, and unfortunately, at least 5 or 6 of them are from India. So all these are confounding factors. So that's the negative news. The positive news, is that people are getting more aware. When I talk to some of my colleagues at the major cancer centers around the country, they are saying the number of people coming in early stages of disease, especially breast cancer, have dramatically gone up. Nowhere near where we would like it to be. Even for oral cancer, I have people coming up with aphthous ulcers or white patches now that just, doctor, please make sure that we don't have cancer. But the road is dark and deep, and we have many miles to go before we sleep, as I say. So things are not doom and gloom. I will definitely not give the message, and I'm sure my colleagues will agree with me. But it really requires to be part of our DNA now, that rather than putting a band-aid on a disease and trying to sort things out, we should prevent it and catch it as early as possible. Of course, not all cancers can be caught early. Things like brain or pancreas or gallbladder, which are not uncommon, but they're relatively uncommon, that you really cannot prevent at the present moment, at least.
Yeah. Thank you so much for those interesting points and very important points as well. Dr. Limaye, Dr. Mehrotra also mentioned about, now proactive healthcare, which he says preventive is a passive. Probably we should talk about proactive wellness. So one problem with dealing with cancer probably is also the huge financial toxicity that comes with it, because while Dr. Mehrotra was mentioning about people not going to seek healthcare, the healthcare seeking behavior of Indians, one reason probably is also because of the cost that it incurs, and since many people have to actually bear the expenses out of pocket, people try to naturally delay it as far as possible. Please correct me if I'm wrong. So of course that's a huge issue, and particularly in case of cancers, we have known since ages now that how families financially, mentally, physically are ruined if one person in the family has cancer. Now there are so many immunotherapy, targeted therapy, these kind of drugs are available, which improve survival dramatically even in late stage cancer, but the question is how many people can access it. So on this I would want to hear from both of you one by one. We'll start by asking you, Dr. Limaye, how do you see cancer care improving over the years in the coming times, that despite of probably schemes like Ayushman Bharat and all, which are probably aiding to some extent to poor people, but cancer care is very, very expensive.
So I will just take a leaf from what Sir was just saying, and I would like to outline that even more. I was recently speaking to a crowd of 2,000 in Surat,
Mm-hmm.
and it was a cancer care talk, health talk, appeal, cancer awareness talk, whatever you want to call it, because this was to general mass. And I asked the room full of 2,000, how many of you are above 50 years of age? And literally more than half of that room lifted their hands. And then I asked, how many of you have screened this year? And this is a five-star place, right? Two hands went up. Two hands went up. And then I asked, how many of you have vaccinated your girls and boys with cervix cancer, human papilloma virus vaccine and cervix cancer vaccine? And four hands went up. So what I want to say is that cost is not always an issue. I actually take a leaf from Sir and want to say that it is also that we are a non-screening nation. The orientation of the masses has to change. We have to, and I've said this again and again, so you may actually find the same phrase, the same pitch, but we have to revolutionize screening. Truly
Right.
have to revolutionize screening. We have to, as masses, we have to, as a community, we have to accept screening. It cannot be handed down by the healthcare professionals. It has to be people like yourself who have to make it glamorous, and you have to say that screening is the way to be. I participate in a screening initiative called Sanjeevni United Against Cancer. I don't know if you've seen it. Mrs. Vidya Balan is the ambassador, and she coined a term saying time nikale screen kare. I think this has to be the mantra. It has to be everywhere. All of us have to, and that's where cancer has to be nipped in the bud. Whichever cancer we can. I mean, we cannot screen for everything, but wherever we can, we have to be nipping it in the buds. I also say only paranoid survive. Things like that, which essentially mean to spread the message that if someone is having a symptom, a breast lump, a neck lump, an ulcer in the mouth, anything that bothers them, a cough that has been persistent, if the sputum is coming with a red tinge sputum is coming, weight loss, all of those things have to be addressed in time. If someone is having these symptoms that are bothering them, they should seek medical help, and they should continue to pursue that till they figure out what is going on with them. Nevertheless, screening should be a way of life, and we must ask each other's families. When you're having a conversation, a get together, one must know. The other day I was talking to a cancer survivor who said, I gift screening on birthdays. So empowering each other to screen instead of giving a gift that no one needs on their birthday, give them a screening. So all different kinds of methods to make screening more fashionable, more in, more right thing to do, the right way of living. Those need to be incorporated, and that's how we can then, in a resource limited nation, even if we have to pay some, we are doing it when it's least expensive. We are curbing and tackling cancer when it's least expensive. Now, to address the second point that you've made in terms of cancer care being very expensive. So yes, cancer care is very expensive, and that is why you want to not have the cancer. You want to take preventative actions, and screening is one way. Even families that know they have cancers running in multiple generations don't screen. That's the kind of orientation we have in India, which absolutely needs to change, because there are certain high risk families that are still not screening. They're just coming down with cancers and paying more and more for cancer treatment. Coming to cancer treatment in particular, two things have to happen. One, of course, the government has to step up and participate more. I'm grateful for Ayushman Bharat, but things have to improve even more. Higher care has to be given. Cancer care being expensive, higher cost coverage should be offered for cancer patients by diagnosis instead of for a general population. But there is a large value of clinical trial presence in the country. In the West, a lot of novel drugs are made available to patients only through clinical trials. These are not essentially early phase trials, first in human trials. I'm talking about established drugs that are even late phase trials. Very less number of such trials are running on an annual basis in the country. And there should be a larger presence of clinical trials. There should also be larger acceptance of clinical trials in the country. It's a demand and supply equation. Pharma companies need subjects on their trial to be able to mature their drugs for FDA approval. We need these drugs for our patients to receive novel drugs which can be completely outcome changing, transformative for the patient, and the access could be made through clinical trials. So we really need to come together to welcome more clinical trials in the country, open more trial centers, and make the masses aware of how to navigate through clinical trial systems, at least those that are educated, aware, families that are getting anchored by today's young generation should know how to go about getting the best care for their loved one.
Thank you so much for sharing those thoughts. Dr. Mehrotra, your thoughts on the financial implication of cancer care?
In one word, killing. In the sense that one of the there have been multiple number of studies, so I won't bother about taking to the exact details of how it can be a catastrophic event, not only finishing whatever savings the people have, but in addition, people have to spend quite often their lively, not only their homestead, but also if you are a farming community, people sell their land and still may or may not get any benefit. So financially, it is a recent paper which actually talks about thousands of crores of the actual cost, the financial cost of, if I remember right, it was about nearly 2%, little less than 0.5% of the GDP of the country was the actual amount that was spent, not only in treatment, but also in the number of man hours lost and output. So overall, in spite of the fact the numbers are relatively small compared to the West, but since most people are spending out of their pocket, you mentioned about Ayushman Bharat, which is definitely a laudable event that covers the bottom 30% of the country as far as finance is concerned, and also lately, I think anybody over the age of 70 now is covered up to an amount of 5 lakhs for each family. However, uh, and you might be surprised to know that the major proportion of the Ayushman Bharat funds goes into cancer treatment. And breast cancer, unfortunately, remains number one as far as the costing is concerned. So when I was in the government of India, we were part of the costing committee, and we could say that what are the maximum amount that can be spent on which cancer and what are the standard treatment protocols. But the fact really remains that many people either are not aware or they do not really have access. I mean, you might be well familiar with the problems that we have faced as far as reimbursement is concerned. So a lot of hospitals now are slightly disillusioned, and the attempt to make sure that the payments, which are of course huge in number, um, the private hospitals, they do need to be reimbursed. So that scheme, I believe, is being revamped and to make sure that the proper payments are made at the appropriate time. But the challenges are many, and some people don't even go to the physician, even if they know. I mean, you may have a tumor of a size of a cricket ball or even larger, you do not go that, if we do go to a doctor and they find something wrong, how are our savings going to be sorted out? Although treatment is officially free in most government hospitals and tertiary care centers, but access, awareness about their access, and also the problems people face when they reach the hospital, that is what is known as the patient navigation. Where our hospitals are huge, they're crowded, and to get to the appropriate person sometimes is like a maze for most people, especially coming in from the semi-urban or even urban backgrounds because of their skills in ability to navigate. So now some of the hospitals are starting a patient navigator system because to decrease the delay from diagnosis to treatment is a very important issue which people don't talk about it. The other issue which Sumi, I would like to raise here is cancer survivorship. Our organization and many others are really talking now with people, at least a small proportion of people coming early, getting treated, and with good treatment, especially, for example, breast cancer, which is the most uh, prevalent cancer. More than 60 to 65% of the people do survive for 5 years, although that is much less than the West, where in the best centers it is up to 85 to 90%. But 60% is a figure which really wasn't there even 10 years ago. So lots more people are surviving. Even head and neck cancer, if caught early, is nearly very well controllable, if not cured. So but now they are left that they have been treated, but nobody's actually talked to them about the problems that you face when there is a side effect of a long-term side effect of a treatment, or the risk of recurrence is always there. So we are very much into now talking to people that how to act as a support system. There are various patient cancer groups, especially in breast cancer, but in other cancers also now gradually things are increasing. Lung cancer, now people are surviving for years, at least some of them. And this support group system is also hopefully going to keep pace with the number of people who survive cancer or who are champions who have come out of the disease and face so many problems. So that is one area I feel through sources like podcasts and newsprint, like from folks like you and others, will have a very strong role to play. And now our organization has been contracted by you working with the organization like Echo India to build the capacity in all the states of the country. And you'll be happy to know we finished, I think, 5 states. The last one, the present one that we're doing is Ladakh, and we are hoping to cover the next 20 states as we go along. Improve when the doctors don't know what to do, how are we actually going to talk about patients? So it's a small step, and now there's another cadre called the community health officers, CHOs. That is one more area, and we have oncologists practically from all parts of the country who are helping us do that. So a lot of things are happening. It's not that all is doom and gloom, but yes, as we discussed, and as Dr. Limaye also talked about, awareness and access as well as affordability, all these three things go together uh, to come to a relatively good, early diagnosis, good therapy, and a great survivorship. These are three things which I feel are important. And also the attitude of the family and the friends, that is also changing. The taboo. Earlier, you might remember, till a few decades ago, cancer, it was like a death sentence. Due to better facilities, you have so many people who are getting treated and who are surviving. So I think, and there's so many celebrities who are talking about it. But at the same time, we have cricketers, we have film stars, we have political leaders. I think we all know the names. I will not go through those details. So those people have actually helped. And also, the prevalence of smoking is definitely gone down with so much effort being done by so many people. At least cigarette smoking is down. BD smoking and smokeless tobacco, which really constitute practically 80% and more of our tobacco issues, is still very high. And unfortunately, they're still being glamorized by a variety of influencers, both from the film world as well. And they're getting paid huge amounts of money. We can talk about that till the cows come home. Nothing has really changed in the last so many years. So that is one area which we talk about chewing tobacco and gutka being sold by various organizations with very similar sounding names and packing and logos as the non-tobacco containing products. I think that the government has been taking steps, but that really needs to be, in addition to the government, I think it is the people of the country who should really be acting. Still, in our sporting events, you have these various ads of various companies who are selling these very similar packings of tobacco. That is something that is completely preventable.
Yeah. Thank you so much, sir, for that balanced and very nuanced answer. So, before we wrap up this conversation, I would, because the focus has a lot been on awareness as well as prevention of the cancers which can actually be prevented. So, if I asked you to list 5 things, 5 advice that you would like to, give to our viewers on how the common cancers at least can be prevented, what would those be? We'll start with you, Dr. Limaye, if you could start.
So, very easy to answer, at least three of them very, very clearly. One is oral cavity, and that is, something very in front of us. can easily be examined and prevented. Self-breast examination is another very easy to practice, especially right after periods. A woman, especially in a shower, can examine their opposite breast with their opposite hand, both under the armpit, in the armpit as well as the breast. And at the earliest, bring up a lump to their doctors, to their Anganwadi workers, whoever, not be shy, bring this up to their healthcare workers as soon as they notice something. The third is to do a pap smear. And in the same league, I would say for young girls, do the HPV vaccine to prevent cervix cancer. Very, very critical, even for young boys, um, for anogenital cancers, and for HPV positive head and neck cancer. Uh, so these are the three things that can be said very easily. And fourth, I would say diet. Today, eating right is very important. But the higher evidence we have, even more than the diet, is with exercise. And more cancer specific outcomes are getting published. More recently, in the Gospel of, of Medicine, which is New England Journal of Medicine, where we saw cancer related publication coming through with enhanced survival, decreased recurrence with exercise. So I would really pitch for mild to moderate intensity exercise at least 5 days a week. And that goes longer than all these fads that we have around diet. So these would be my five things. Uh, and of course, time nikalein, screen kare.
Yeah, thank you so much for that. Dr. Mehrotra, would you like to add as well?
Not really. I think Dr. Limaye has covered all. As a matter of fact, just to emphasize the same points, I know it sounds very cliched. We keep talking about it, but we ourselves don't do it. When Dr. Limaye talked about those public meeting with 2,000 individuals, I had a similar um, s- experience with doctors at a doctors conference, and unfortunately, the number of people who themselves got screened or got their daughters the HPV vaccine was the same. The second issue, as Dr. Limaye talked about, was if I were a pharma company, suppose I was Biocon in India, or I was Merck, or GSK, or whatever in the outside, I would just make a pill in which we would put diet and exercise together, and ideally exercise. I can assure you, I would make $1 trillion or dollars or whatever
Unfortunately,
overnight.
that doesn't happen, and probably that's why exercise is not as important.
So, I mean, there's a famous cartoon which you might have seen. There are two counters in a hospital. One says, so and so medication. Others says exercise and diet and lifestyle
There are
counseling.
no takers for that.
Absolutely none, zero, as compared to 1,000 odd people standing in a line, very patiently waiting for pills. So if exercise were a pill, and it's not a huge amount of time. Nobody is so busy you cannot give 2.5 hours. The WHO recommends 150 minutes a week of moderate exercise. Uh, but that requires effort. Unfortunately, you cannot sit on your sofa or be a couch potato and still exercise. I don't think that technology is there. Things are definitely improving by various, especially with the time of social influencers and even the prime minister doing yoga now, at least on television once a year. That whole thing has changed. People are moving out, especially when they get to a certain age, you can see various colonies. But to be honest, it is more of especially the morning walks and so on. It is more of a gupshup session and sitting in the park rather than actual exercise. But definitely, if you look at even a decade ago, people are moving. I somehow seem to be harping again and again how things are improving, but they are actually, and especially since I travel quite a bit and I visit various parts of the country. Open air gyms has been a great gesture by so many residential areas and the government parks also, that I see a lot of people taking part in that. The unfortunate thing is youngsters, especially kids, are very few and far between. It is mainly the elderly who I see in these open air gyms. So the concept of the kids going to a neighborhood park and playing, and hopefully in a clean, pollution-free atmosphere, that is a problem. And as you well know, these habits start early. So if you are getting into the habit of playing, whether it is education pressure, or it is peer pressure, or it is the various electronic devices, I think getting a healthy India starts young. As they talked about the cricket team, catch them young. That is very important. And we are and many other organizations are promoting with us, getting in. In the US they have this "Make America Healthy Again." I think India needs to stay healthy. That is more important. And one of the main things is starting from childhood, the junk food. Tobacco, of course, is absolute taboo. Um, Ideally, a good, clean atmosphere where you have exercise. These are basic rights that the person should have. It is not something which is a luxury. And that is where I feel we should be going. In addition to all the other things that we talked about, regular checkups, whichever physician or healthcare facility you have to go to. I mean, we talked about gifting, and I think February is Valentine Days, right? And then you have birthdays, you have anniversaries. These are very easy dates to remember. 1st of January is the first day of the year. I mean, I have friends for every year for the last many decades, 30 to 40 years. On the 1st of January, they have been at my clinic. The doctor, I've just come for a checkup, make sure everything is fine, then we can go on to whatever we are doing. It's a very simple thing, and that message can be easily passed. So, and now we talked about cost. The reality is, you go to one of these fancy coffee shops for a cup of coffee. For three people, it'll take you the same amount of money as goes for a basic checkup. So I refuse to believe that for the majority of the country, cost is the issue. It is, and as they say, where there is a will, there's a way. And I can cry myself hoarse, please do this, please do that. Nothing is going to change. I've been at these sessions for years and years. The advantage that comes is, and the change that comes is, once your own colleagues, your own people who you admire, when they say, okay, we've done this, what about you? That is the kind of public awareness and participation. You cannot depend on the government for all these things. I mean, that is not the government's role in the first place. So is when people like you and me talk to our own, for example, our house help, our neighbors, our elderly uncles and aunties, that, why don't I help you do this? That is when thing changes are going to happen, and I'm sure they will. I'm very positive that we are definitely going for a healthier India. It may not be today, may not be tomorrow, but day after, definitely things are going to improve.
Thank you so
One
much
last
again.
thing I wanted to mention here, if you allow me. Sir spoke very well. I just forgot to mention one thing that I must mention here. We as a nation also don't buy insurance. Those of us who can buy also don't buy insurance. And when we buy very little insurance. We buy bigger cars, but we don't buy insurance.
Now
So,
with
investing in
GST
insurance.
rates not being there, I'm sure there would be more people who would probably be interested in buying health insurance, which is a
Yeah,
must.
proper health insurance that covers cancer therapy also is very critical. And that's also a responsibility that we have, in terms of people who are anchoring families. They should ask each other, screen kiya ki nahi? And what is your insurance policy? Are you covering for cancer? That's it.
Yeah,
That's a very important point. Thank you for bringing
yeah,
that
yeah.
up,
Very important
because
from both of
because
you.
it let me give you one small example from my own experience. I have a lot of friends and family who are in the army. And as you know, in the armed forces, yearly checkups are important. So there was a commanding officer of the military hospital, himself a doctor, who, when he happened to go for a checkup, well, that is mandatory for you. If you need a promotion, if you need to stay in the armed forces, you have to have a yearly checkup. And on a routine X-ray, they found a small spot, which, when investigated, was actually the earliest lung cancer finding. And lung cancer, especially due to smoking, is one of the most deadly cancers, as you know. The survival is very poor. So immediately they could take action, and they could remove not only the tumor, but half the gentleman's lung. and this person is fit and fine right now. So getting that yearly examination done as just a routine physical, once that is looked after, forget cancer. When we were in the government, we started off with a cancer clinic, in our institution. But unfortunately, we found no takers there. Nobody came. When we renamed it a wellness setup, right? And people used to come for various other investigations or various treatments, and they're all right. This is a wellness setup. You have to go through the wellness setup first before you go for treatment or the investigation. The number of people there was absolutely surprising. Even I was very surprised to be. I didn't expect anybody to be there, and the number of people caught with early cancers because we had all the diagnostic facility, and it was from the government, and it was free. And obviously, you had people who had the passion for early diagnosis in their minds. So the doctors and our paramedical workers were extremely motivated. So that is how we could change things. But whether we can multiply that same uh, efforts countrywide, there's wellness centers and Ayushman Bharat um, clinics that have started now. I'm quite hopeful things will improve. It may take time, but it will happen. And I think that's a very valid point, getting insured. And this Ayushman Bharat has changed definitely a lot of things. Now people are demanding to be treated, but the government cannot really look after all the expenses. It is if you don't take things in your hand, cannot. I talked about proactive medicine and proactive care. Your health is your problem. If you don't look after it, nobody else will.
Thank you so much, sir. With that, we come to the end of this discussion. Really appreciate that both of you could take out time and join us in the very
Thank
important
you,
topic.
and all the very best to both of you
Thank you so much.
in your
Thanks
efforts.
for the time.
Keep at it, and we will succeed. Thank you.
Sure. Thanks, sir.